All right, welcome everyone. We're happy that you can join us today for this third session of the Campus COVID Q&A webinar series. My name is Sue Ng. I'm the Deputy Director in the Office of Administration and Finance, and I will be your moderator. This is a safe space for you to ask questions about COVID vaccinations, boosters, masks, safety measures, and other COVID-related items in place at Hostos Community College. This session is being recorded. Closed captioning is available. You may submit your questions in the Q&A box, or if you're attending by phone, please raise your hand and I will call upon you to ask your question. Today, your panelists are Fabian Wander, Director of the Health and Wellness Center, and Zack Korenstein, Environmental Health and Safety Consultant, and special guest, Public Safety Director, Chief Arnaldo Bernabe. Without further ado, let's get started. I will start off by asking each panelist to introduce himself and describe their role at Hostos. We will start with Fabian.
Sure. Good afternoon. Thank you, Sue. Hope everyone's doing well, enjoying this beautiful day today. My name is Fabian Wander. I am the Director of Health and Wellness Services here at Hostos Community College, and I oversee a lot of the COVID vaccine policies as it relates to students on campus. Thank you.
Hello, everybody. Welcome to Campus COVID Q&A. My name is Zack Korenstein. I'm the Environmental Health and Safety Officer for Hostos Community College. Related to COVID, I am involved in varying COVID policies related to masks, sometimes ventilation, but touching upon many varying areas that are non-medical. That's more for Fabian and his team. I'm more interested in the preventative measures we can take to control the virus as best we can. Non-COVID things as well I might do, laboratory safety, and other environmental and health and safety items. But today, we're focused on COVID, of course.
Thank you, Zack. Chief Bernabe.
Hi, Sue, and good afternoon to everyone on this meeting. My name is Arnaldo Bernabe, and I have the distinct pleasure of serving the college in the role of public safety. I'm responsible for the overall safety of employees and students and CUNY's property. And I also oversee the fire safety program for the campus, in addition to a bunch of other little things that we'll tell you another day. But as far as it pertains to COVID, for the past 2 years, I've been helping the other stakeholders here at the campus and other administrators, and just basically ensuring that COVID protocols and guidelines passed down by the university, that they are being enforced here on the campus, specifically the access control, making sure that everyone does have proof that they have been vaccinated, or that they have a negative PCR tests, and or that they're wearing their masks properly, covering their face and their nose.
Thank you, Chief. I think we'll start off today's series of questions with one from last week. An attendee had asked about if we have a policy on children on campus, and I will ask Chief Bernabe to respond to that question.
Sure, thank you, Sue. So yes, there is a policy during this COVID period. We do have a policy and a guideline that was handed down by CUNY back in September. They recently updated that in February, and basically the policy governing children is that they're broken down into 3 different groups. The first group, or scenario, I should say, is a visitor who's visiting the campus with a child. I like to use the example of perhaps a adult student who is coming to the campus to get information from admissions, and they're accompanied with their 15-year-old daughter. The CUNY protocol is that that 15-year-old child must be wearing a mask when they enter the facility, and they are exempt from testing. The scenario with a student, let's say, attending a performance or an assembly at the college, let's say at the theater, is that that particular child also would be exempt from testing. However, they would be required to wear a mask as well. And the third scenario with children might be children who routinely come to the CUNY campus. This could be children in the Children's Center. This could be our own children who come to the Lincoln Academy or College Now programs here at the campus. Those students, if they're taking college credit bearing courses, obviously they're going to required to be mandated because they are students at Hostos. And they also too must wear a mask which properly covers their face and nose. So basically, we're requiring masking for under this policy for any child that's that is 2 years or older must wear a mask when they come on campus. I hope that answers the question.
Thank you, Chief. We have an attendee who has a question. Do we have any indication yet whether the vaccine mandate will apply to COAs and CAs? Some CAs at least seem like they would qualify as non-teaching instructional staff. Fabian?
Yeah, that's a really good question, and I'm not entirely sure what the answer is. It would definitely would be helpful to have someone from Human Resources here to answer that question. I know that there's been conversations between central office with respect to the vaccine mandate for faculty and staff, but I am not sure how it fits in with the college assistants or the COAs, the college office assistants. So it's a great question. We can definitely get back to you with once we ask, the Human Resources Office. I don't know if Chief or Zach, if you have anything else you may want to add.
Yeah, Fabian, I don't have much to add on that. That's very specific. Again, I'm technically a consultant, so I'm not familiar with all the different staffing categories. But as you said, Fabian, I think that someone from Human Resources might be better to answer that. And we might be able to get a special guest in the HR realm for next week. So you could probably stay tuned for that, which would be our fourth session of Campus COVID Q&A. My understanding, as Vivian said, is that there are ongoing discussions with future potential staff mandates. That's all I know at this time, that there are many discussions between the varying unions. Again, I don't know if COAs and CAs encompass that, but varying unions are in discussion with CUNY Central on I believe, a future mandate. Again, I think HR would have to weigh in that more than myself.
Thank you, Zach and Fabian. I just want to let people know that, yes, if you are an employee and you are not sure of what your status is in terms of if you qualify as non-teaching instructional staff, you should speak with HR to determine that. I know the Chancellor sent out a message to CUNY employees sharing that the CUNY Board of Trustees had voted on January 31st to authorize a vaccine mandate for faculty, non-teaching instructional staff, and employees in the executive compensation plan in compliance with a public policy directive issued by the governor. So that is what we have for now. And as we get more updates, we will share it with the community. Thank you. We have another question from an attendee. This may possibly be up Zach's corner. They ask, the water fountains have been turned off since the start of the pandemic. Now that students, faculty, and staff are returning en masse in person, I believe we need to supply drinking water. There is a fountain in the humanities office, but this office is not always open to faculty, and adjuncts don't have access to drinking water that this person knows of in other areas of the school. When can we expect water fountains to be operational again? And alternatively, do we have other water dispensers placed throughout the school? So Zack?
That's a great question. Thank you very much for asking it. And I want to say that this is kind of an indication of the desire of our community, and I think most communities, to open up more. Thank you for bringing it to my attention, because it slipped from my priority list, but I agree that we need to work to actually turn on water fountains at this point to allow folks to start to consume water at drinking fountains, and certainly the bottle. I completely agree. I do not want folks having to buy additional plastic water bottles on a consistent basis. When is that going to come? I can't tell you exactly now, because again, honestly, you helped to bring this to my attention. I'm going to work with facilities and senior leadership to discuss the turning on of drinking fountains. This shouldn't take long to figure out. Give me a little bit of time. By next week, I hope to give you a full answer on that. And maybe even by then, drinking fountains will be in full operation. I agree, it's time that we open these up. I don't want to promise in this moment. Like I said, I want to speak to facilities, speak to senior leadership. That's certainly my lean, which is it's time to open those up. So give me a little bit. We're going to work on that as soon as we possibly can.
Thank you, Zack. We have another question from, I believe, a professor who asks, I have reminded many students to either put on a mask or properly place their mask. Is anyone monitoring mask use on the campus?
Hi, Sue. I think all of us could probably speak to that, but I will start off. The minute the campus opens up every day, our offices are at the entrances of these campuses. We have a supply of masks at these entrances. When people enter the facility, we are looking, along with our safety ambassadors that are in the lobbies, to see if people are entering the campus with a proper face mask and whether they're covering their face and nose. And if they're not, we remind them that they have to wear a mask before they enter the facility. If they tell us that they don't have one, we provide them with one. And we're also walking around. And when I say walking around, I mean my officers, I myself, I know that my colleagues here also walk around the campus. The safety ambassadors, whenever they can pull away from the lobby and helping our students and faculty with their vaccine information on their phones, they've been instructed to walk around randomly also and remind faculty and staff that they must wear their masks. Now, we don't knock on doors and disrupt a professor's class to see if a student is in there wearing their mask. But I have spoken to the officers, said to them, if you are walking around and by chance you do peep into a classroom that has a window on the door and you do see professors and or students not wearing a mask, gently knock on that door, politely ask the professor if you could speak to them and remind the professor that they must wear their mask, and or ask the professor to remind the students to wear their mask. And most of the time, for the past few weeks now that classes have started, people are very compliant. And they quickly tend to adhere to whatever we ask them to. In a few instances, we've had one or two folks who have adamantly refused to wear the mask, and a supervisor of the public safety team has been contacted to visit or to go to that area and speak to people. And usually then the compliance does take place. But if it does not, an incident report is prepared for failure to comply. And that report is sent to the Dean of Students office, if it is a student, and or a respective vice president, if it is an employee here at the college. But I have to say that has really happened since school started. And, again, going back to the question is, are people monitoring? Yes, we are monitoring. We are monitoring this closely. There are also people assigned in the public safety team to monitor our surveillance cameras that are located in public spaces. And so whenever one of these individuals sees someone walking in a hallway or sitting on the floor, not wearing a mask, they radio in to the officers on patrol and say, hey, could you please go visit this area? There seems to be a student or an employee sitting or standing, not wearing a mask. So I hope that answers your question.
Thank you very much, Chief. That was a very thorough answer. We have another question. What avenue is the college using to reach out to students to inform them when they need to report for random testing? Are they only notified via their Hostos Community College email?
Sure, so I'll take that one, Sue. So each student is provided with an individual link for their Clear 4 pass, and that is the pass that kind of communicates to students regarding testing, regarding any other issues as far as getting on campus. So when a student receives that link, they are asked to put in their information, including their email, preferred email, phone number, and a couple other very important details that students need to put in. So if there is a request for random testing, then they would get an email at their preferred email generally to come in and do that random test. It's about 20% of people that are on campus, student, faculty, and staff, that will get a request for a random test. And so then generally that's how they would be notified. Talking about random testing, I just did want to update you all. I believe it was last campus COVID Q&A. It's hard for me to remember the title. There was a great question. I believe it was by Professor Bernardini regarding COVID vaccination compliance or COVID vaccination for students. And, did a little research over the last week, and I'm really excited and happy to report that from what we see, 99.99% of students on campus are vaccinated. So that means that 0.01% of students on campus are either hybrid or on campus fully have received exemptions. So it's basically 99.99% of our students are vaccinated and are not receiving exemptions. So I thought that was really great question that was asked, and I think that was really helpful for us to get a better understanding, for maybe helpful to help faculty and others feel safe on campus, that we have so many people on campus that are vaccinated. So it was just some good information I wanted to share, and thank you for that question last week.
Thank you so much, Fabian. We have another question from an attendee who asks, how are campus spaces cleaned and disinfected, especially when someone tests positive in that space?
Okay, that's a great question. And so, every space on campus, actually since COVID began, actually, we've had a heightened cleaning and disinfecting regime by the custodial team. I want to give a shout out to Julio and all of the custodians who have been here consistently every day since before COVID and throughout the entirety of this pandemic. So when I say heightened cleaning, so typical cleaning procedures, wiping surfaces, wiping floors, using disinfecting cleaners, and typical cleaning techniques. In addition, also what occurs when any space is cleaned is also the use of hypochlorous acid. Some folks know it as fogging. This was big in terms of the airplanes initially during the beginning of the pandemic. By the way, this continues on airplanes and many other spaces, and here at Hostos as well. The fogging technique sprays a mist into the air of a disinfecting material. It's non-toxic. It's completely safe, actually, to be around, but it does some minimus cleaning of the air itself, but mostly does an additional layer of protection on surfaces. And this is the mist falls on surfaces. It gives another layer of disinfecting power to the cleaning of the room. Now, this is done anytime a space is occupied. Obviously, now we have a lot more folks on campus, a lot more activity and life here on campus, which is exciting to see. So the custodian team is in higher gear, ensuring that whether it's a classroom or another office space, if it is being occupied one day, it is being cleaned in the evening time to ensure that by the next day, folks are going back to a space that has been cleaned and disinfected. Now, in terms of the potential of an infectious individual that may have had COVID in a classroom, in a space, an office, what have you, there would be, frankly, similar cleaning and disinfecting techniques, probably additional fogging on surfaces, walls as well, and the entirety of the area because of that potential infectious individual. So I would say deeper cleaning, deeper disinfecting if an individual was found to be potentially infectious on campus. I would say that's become rarer and rarer in recent days. As maybe a lot of you are aware, we are definitely on a low trough in terms of cases. Just to remind folks, our most recent surge, Omicron, that surge has, I don't want to get ahead of myself, it has passed for the most part. And January 4th, that was the high point where it was almost 4,000 cases per 100,000 individuals in New York City. As of today, we're about at 100 cases per 100,000 individuals. In the Bronx, we're at about 70 cases per individual. So we're really, really down at this point. This is a time to be cautiously optimistic. Again, this is not over yet, but we are in a good stage right now in the pandemic. One other thing I want to say about cleaning and kind of tie it back to a question from last week was there was some discussion about wipes. There are wipe dispensers in all classrooms where folks can take a wipe down the desk, wipe down the seat, wipe down any surface that you're about to touch. There were some concerns or complaints rather that some of the wipes were dry, and we have responded. So first thing I would say is that sometimes that first wipe might be dry. I'd say rip it off and look for that second wipe into the roll. Sometimes that one's going to be wet if the first one is dry. However, if the entirety is dry, and of course this can happen, but the custodians are on top of this. And by Monday, we're going to have a sticker on all of the wipe dispensers with a phone number for you to call. I'm going to tell you this phone number right now. This is going to go to the custodian and the custodian supervisors so that they can respond in quick order to ensure that you do have wet wipes ready at the time of your class, the time of your meeting, what have you. I'm just going to tell you right now, it's 6535, 6535, and there's a second number, 6727. 6727. So again, if you're having issues with a wipe dispenser in any space, 6535 or extension 6727. We'll help to share that. But again, these stickers are being rolled out, and hopefully by early next week, you'll actually see the stickers on the dispensers in case that wipe is dry.
Thank you, Zach. I just want to have you stay on to answer this other question, who asks, I noticed that some classrooms have 1 to 2 portable IntelliPure filters in them. Can you explain why the filters have been placed in these classrooms? why in some classrooms and not others, and why the college chose to use IntelliPure.
Sorry, I was muted there. So you know what? There have been requests from specific departments for HEPA filters. I think that's what we're talking about. And so I just want to make sure we're talking about the same thing here. Interpure, okay. Actually, I'd asked the individual who wrote that, is this a small unit within the space? It has a bit of like different colors on it. Again, I'm not 100% certain that we're talking about the same thing, but let me assume that we're talking about the HEPA UV filters that exist in some spaces. Again, this was based on specific requests from specific divisions and departments that wanted extra filtration in their spaces. Now, let me say this. Any of these HEPA filters or other standalone filtration units are an extra item. What do I mean by that? I think it's worth reminding the group that we do have modern, sophisticated HVAC, heating, ventilation, and air conditioning systems that have higher grade filters within them in the air handling units, in addition to UVC, ultraviolet light irradiation that disinfects and actually kills SARS-CoV-2 virus that causes COVID-19. So these extra filters are not necessary. They do provide, I think, some creature comfort and visual indication of additional filtration above and beyond the increased filtration that we've already met with all CDC recommendations. So again, this is by request. And again, if you can tell by the way I'm responding, this is an extra item that, again, I think goes more to the perception of cleaner air, because there are no spaces on campus that do not have filtered air that is far above the typical in our spaces. So, again, and forgive me for not knowing the precise name of the HEPA unit, but you took a very close look at that. And so that's what they are. These were specific requests by departments where we did provide some of these HEPA filters. And by the way, some folks, in fact, bring in their own filters and fans to the unit. So again, the one I'm thinking of has lots of nice, pretty lights, green and red and this and that. Again, I'm assuming we're talking about the same type of unit rather than one that someone else brought in from home. Regardless, this isn't really necessary. It adds to the perception of better air.
Thank you, Zach. Our next question is probably best answered by Fabian. If a student is due for a booster but does not get it during this semester, are they dropped from their classes?
Thank you. It's a great question. If a student is due for a booster, and just remind folks, if you have your Pfizer Moderna vaccine, you are due for a booster 5 months after that second shot. So let's say you took your shot January, February, March, April, May, June is the date that you're due. I use my fingers to count because I can't do the mental arithmetic right. So we know June, you're due for your booster, right? Now you have 30 days to input that booster into CUNY first. You will not be dropped from classes this semester. However, when you want to register, and we always encourage students to register early for the following semester, you will be blocked from registering. Now, if you received your Johnson & Johnson vaccine, that's 2 months after your first shot. So yes, it will not impact this current semester. But if you're trying to register mid or towards the end of the semester when registration opens and you want to get the classes that you really need, it's important to stay on top of that. This way you will not be stopped from registering for either the summer or the fall semester. Oh, and one other thing I wanted to mention, great news that will be coming out soon. Thanks to the Senior Vice President's office and Human Resource Office, we'll be having COVID shots back at the school. The location, I think, is being worked out. It's going to be on Tuesdays and Wednesdays, starting February 22nd. Again, Tuesdays and Wednesdays from 9 a.m. till 6 p.m. There'll be a COVID vaccine, I guess, bus or van out there. It originally was between the B and the C building. Perhaps the chief can confirm that. But we'll be giving out the boosters on campus, right outside the campus. So any students, any faculty and staff that want to get their boosters, it's really convenient. Walk in from 9 to 6 p.m. starting February 22nd. Chief, is that?
That is correct, Fabian. The van will be located in the proximate area or space between the B building and the 450 building during the days and times that you've indicated.
And communication will go out shortly, but I couldn't help but share that great information. And so it's hot off the press.
Fabian, since you've shared that information, I'd like to share some other information that's also hot off the press that we shared a little earlier with the college community. And that is that the college cafe is now open for students or faculty or staff to eat their meals and or study or to just simply chat in between classes. It will be open Monday through Sunday from 9 a.m. to 6 p.m. All that we ask is that people are conscious and maintain, some type of social distancing or be aware of others' personal space, and that you wear a mask at all times, properly covering the mouth and the nose. I also want to share that the facilities department and the division of administration and finance also has purchased and already installed some new furniture on the 5th floor and 4th floor of the C atrium, which were areas that our students frequently used to study before the pandemic. That furniture had all been removed because of COVID. So we have new furniture in those areas that our students can also enjoy the space, sit and enjoy the space and the new furniture.
Thank you, Fabian and Chief Bernabe. We have another question in the Q&A box. The attendee asks, what should faculty do when students are exposed in another class or space, not their own?
So I think we had Nurse Vasquez was here last week and answering some of those questions. But if a student is exposed and they inform a faculty member, we highly encourage the faculty member to reach out to our nurse directly via email or via phone, or the student can reach out to our health services office directly. We will follow up with that student, ask several questions, find out more information, and then we will proceed with our policies in contact tracing and notifying the student and the students that may have been impacted and faculty and staff, et cetera, what the specific protocol would be. It's taken case by case. Every situation is different. So there is a protocol in place, and our nurse is very diligent to follow that. We also, as I didn't mention last week, but we've hired one college assistant, and we've hired someone to help with contact tracing, started this week, and we'll be starting a third person next week. So we have a lot of support in the health services office to help. We also work very closely with the Human Resources Office that also follows up with faculty and staff concerns.
Thank you, Fabian. We have another question that may be best answered by Zack. The attendee asks, follow up on fogging. According to Clorox, who makes the disinfectant being sprayed, the people spraying it should wear eyewear protection, gloves, and N95 respirators. Are Hostos custodians regularly provided with this PPE? Also, Clorox's own toxicology sheet for the product lists minor possible health effects in the short term and several unknown health effects in the long term for repeated exposure. Since scientists now agree that surface cleaning is not the primary way to prevent COVID transmission and health risks to custodians are uncertain, will the college consider scaling back or stopping such spraying?
Great questions. And good on the attendee looking up Clorox's specific toxicology information. So to the point of the custodians first, yes, they do have access to all PPE to ensure their safety during the application of not just the fogging, but other cleaning materials that they interact with. Of course, it's not just one. Let me go into a little more detail on this too. So this is correct. Clorox makes a product for the fogging. There is another technique to obtain hypochlorous acid, and that is actually to generate it on site. And what I was referring to actually was this second methodology. It's actually water, a salt solution, and electricity. Okay. Now, when we use this method, that word's going to keep messing me up. The toxic effects of the Clorox product are stronger than the second method. Again, the second method being generating on site. We have these units on site. And interestingly, this actually predates COVID, okay? We've had this system on site that uses, again, water, salt, and electricity to actually generate a non-toxic alternative to the Clorox product. So in fact, oftentimes, not always, sometimes they use the Clorox product, sometimes they use the hypochlorous acid generated on site at varying stations in janitorial areas, where it's the same machine that can be used where they're fogging the hypochlorous acid. And when they use the material that's generated on site, like I said, there is less hazardous attributes to that type of methodology of hypochlorous acid. But regardless, the custodians have at their disposal any and all PPE to ensure their safety, and we go through training on that on a regular basis. Now, in terms of fogging, continuing, or pulling back, that's always up for discussion. As I said before, this is an extra layer of protection, an extra layer of disinfection. And as I've talked about before in other possibly webinars, and certainly when talking directly to Hostos community members, everything we do is a layered approach. If for some reason, and again, hopefully I've helped to show you that this fogging is not an overly hazardous operation, especially when the method's used with the solution generated on site. If for some reason you're uncomfortable with it, you don't want it to take place, it can be scaled back. And that has occurred on site for those departments that have been on site. I'm not going to give you specifics on that, but it is a little more time consuming. And so it took time away from some classes. And so sometimes that could be scaled back. Remember, all of these mitigating efforts that we are employing is a layered approach. And the way I like to put it is that we have masks, vaccination, rules on occupancy, cleaning techniques, all these layers of my hands are open. There's holes in them. They are layers of Swiss cheese, right? We're going to layer on each layer of mitigating efforts to control COVID-19 as best we can. We're not going to end COVID. That's not really possible. But Now, in February of 2022, we have many more tools that are effective at mitigating that risk and reducing that risk. We are not going to eliminate the risk of COVID. As I think I've said, at least in the first webinar, COVID will be with us as long as humans roam the earth. This is a risk that all of us are going to have to learn to accept and put on our list of hazards that we may face on a day-to-day basis. The pandemic is not over. And, some people are in the mindset that it is over. If you watch the Super Bowl over the weekend, there isn't one celebrity that wore a mask. That is not what I wanted to see. And that is not the example that we are setting here at Hostos. The governor of New York has been relaxing mask mandates. I'm very happy to hear that our mayor, Eric Adams, was pushing forward on mask mandates. Again, New York City, the Bronx, it's not New Paltz, it's not Rochester. We are the most densely populated city in the nation. And as I said, I am cautiously optimistic. We continue to have our mask mandate. We continue to have our cleaning regime because we want to do the best that we can in an imperfect set of tools ultimately. None of them are 100%. None of them can ensure 100% safety. But layered together, it does create a much safer environment for everyone to come back to. I'm thrilled to see as many people on campus, more people than I've ever seen on campus. Again, I started here at Hostos really in the midst of the pandemic in March of last year, 2021. And so I love seeing everyone back on site. And as Chief said, I am also enforcing mask rules. It's usually rare for me to have to ask people to put masks on. Just today, a student, I came up, I walked up to a student, was going to just walk by him. He put his mask up. I didn't say anything. I hardly looked at him. I think many people are understanding the contract in society, especially here in New York City, that is respectful to cover one's face at this time. At the same time, we have to remember that we are at a different stage in this pandemic. We are moving, I think, quickly towards an endemic phase of this pandemic. Just by the attendance here we have today, we have less attendees than we've had in our previous webinars. Many people want to open up. The drinking fountain question was a good example of that. And we will continue to open up. My hope and my aim is that we will keep our mitigating protocols at least through this semester. But I want everyone also to understand that as we move forward, we will be on campus in a day, someday in the future, where some folks will not have to wear a mask, where mask mandates will be relaxed. And it's okay for you to continue to wear a mask. And on masks, let me remind you, we have KN95 masks available for the public at any building on campus. All you have to do is go up to a public safety officer in the lobby, ask them for a KN95 mask. You can ask them for a surgical mask as well, and they will have them for you. We've handed out hundreds of KN95s. We have many more, and I want to make sure that everyone who wants one has access to one. We have sufficient supplies. I know there were some questions about reordering, but again, at this point in time, I do not see a high demand for KN95s based on the number that we've given out. I'm speaking to everyone on this webinar and the community. Please do use a better mask. We have them here for you. All you got to do is come up and ask. Let me just add too. Over the weekend, I went to my local Duane Reade. Right on the table, there were a whole bunch of N95s available for people to take. Okay. My mother-in-law, she went to her local pharmacy as well. She just had to ask for a few N95s and they were handed out. Different types. And again, you don't know exactly what you're getting at first. I will tell you in my experience, They were excellent masks, very high grade N95s. And again, free to the public. This is from the US government. They've sent out these N95s to pharmacies. Again, this is my experience in Brooklyn. You may have different experiences in your neighborhood, but again, we have KN95s available for you in the lobby. Please come pick them up if you want them. Again, pharmacies, N95s for free from the US government. And again, I want to remind everybody, these mask mandates statewide, nationally, are rescinding. Don't go so fast. I encourage you to continue to mask up. I'm fully vaccinated. Everyone on this call is. They know how vigilant I am with my mask use. It's an easy way to mitigate the risk and at the same time, join back in society, get back to being closer to people physically with a mask for now. It won't last forever. But again, I encourage you to continue to mask up during this phase. We're in a very good phase where we're way low on caseloads, but let's continue to be cautiously optimistic, everybody.
Thank you, Zach. I just want to let the attendees know that if they have any questions, to please put them in the Q&A box. We do have about 10 more minutes, so if you have questions, please do feel free to type them into the Q&A box. So as we wait for any additional questions, if there are any other announcements that Fabian, Chief, or Zach would like to make at this time, please feel free to do so. I know you've kind of done a really great job in just clarifying that now the Hostos Cafe is open for students, faculty, staff to sit and have their lunches or, breakfast and dinners, as long as they're taking the necessary precautions. That we have new furniture in the 4th and 5th floors of the C building. So that's additional spaces that students, staff, and faculty can enjoy. And then I believe, oh yes, and also the vaccinations will start next week again, Tuesday, February 22nd. And that is on Tuesday and Wednesdays. Is that correct, Fabian?
Correct, from 9 a.m. till 6 p.m. Outside on the Grand Concourse between the B and the C building. Also, again, want to thank all of the students for really making an effort to get vaccinated so they can come on campus. I know it was, there were many students that were unsure, and we were able to provide some information to them, and they did their own research. But you can see, they were so motivated to come on campus. And I know, because I've had many conversations with students throughout this process, that they were motivated, they got vaccinated, they followed all the policies, and I'm happy to see all these students on campus because of that. I also want to thank all of the advisors, all of the other support staff and faculty members and public safety office that work with students and educating them about the vaccine, about the policies, and encouraging them to get vaccinated. And also, of course, the administration that really provided the vaccine, worked with the organization to provide vaccines on outside of campus, which has been a really big help. And whenever I read a vaccine card and I see, the word Hostos, that they got the vaccine at Hostos, it makes me really happy because I know that we've added to help increase those vaccine rates around New York City. And I'm proud of that. So I really want to thank you all for your efforts. It was a major effort, and I think everyone did their part.
Fabian, I just want to echo, your comments, and I kind of want to give out a special shout out to our student safety ambassadors. Because when, we thought about having, people in those lobbies that could help students who were coming in, and faculty and staff, and the safety ambassador job description was being tossed around, we were lucky enough to immediately be able to bring on board some of our very own students in the nursing and dental hygiene department and in the community health program here on the campus. And they have been marvelous. I tell you, they have been marvelous. They have learned how to navigate, bringing up CUNY First on the cell phones and ensuring that students and faculty have been able to upload their vaccine information, that it's approved. They quickly knew who to contact if there was a problem, be it Nurse Vasquez's office or Human Resources. And they're on their feet the whole time that they're in those lobbies. They're out there 5 hours straight on their feet working. And so I talk to them all the time. They love what they're doing, and I just want to give them a shout out.
Yeah, and just thank you, Chief. I think we definitely need to honor those students. They are fantastic and so patient, extremely patient with our students. And again, our rates, vaccination, and thanks, Professor Bernardini. That question last week, doing the research, we found that 99.99% of students taking classes on campus or hybrid are vaccinated. So it's basically 0.01% that received an exemption. So we're really proud of that. And thanks to everyone that participated to get us to that point, which is really remarkable and shows how motivated students are to come back on campus and study.
Yes, indeed. We're very appreciative of the student ambassadors and everyone in public safety and everyone who's been involved in keeping this campus safe. Fabian, we have an attendee who might have missed your response earlier. So can you please go over what is the procedure if a student tests positive with regard to attending class?
Yes, so if a student tests positive, then we want the student or the faculty to get in touch with our health services office. That number is 718-518-6542. They can always just check on the Hostos website. Or they can email our nurse, M.A. Vasquez at hostos.cuny.edu. If they test positive, the nurse will interact with that student to find out more information. And at that point, that student's ID will be deactivated because the public safety office will be notified. And they will not be allowed on campus until the nurse clears them to return to campus. And once they are cleared to return to campus, then, the public safety office will be notified to reactivate that ID.
I mean, I just want to add that while that might happen very slightly so often, the fact is that when a student does test positive, the public safety, my office directly gets notified, and the ID card is immediately frozen. So we really try to minimize the chances of a student entering the campus with a positive result. But you're correct. In the case that it does happen, if the result does come in after the student has already entered the campus, then the procedure you described is exactly what occurs.
Thank you, Fabian and Chief Bernabe. We are now closing upon the hour. I would like to take this opportunity to thank Fabian, Zack, and Chief Bernabe for the valuable information they have provided today. Thank you to all the attendees for coming and for sending us your questions. Should you have further questions that we were not able to get to today, please feel free to send them to the covid19@hostos.cuny.edu email address, and we can send you a response or come to the next session. A notification will be sent out to the community shortly announcing the next Q&A session on Wednesday, February 23rd at 2 p.m. Thank you very much and have a wonderful day.